Hi everyone, it's Diana. Have you ever repeatedly examined your body for disease or illness symptoms? Try regularly scheduling appointments with doctors for assurance or putting off getting checked up because you're worried about getting terrible sickness. Avoiding situations, persons, or activities out of concern for one's health and discussing your health and potential illnesses all the time. If so, you should watch this and make sure to focus your attention throughout the video. We will be discussing about illness anxiety disorder. In this slide, you can see the contents of the presentation. Okay, now we will be proceeding to the description of it. So, illness anxiety disorder is also known as health anxiety. It is previously known as hypochondriasis or hypochondriasis is a mental health condition characterized by excessive worry and fear of having a serious medical condition. Individuals with illness anxiety disorder are preoccupied with the belief that they are suffering from a severe illness despite having little or no medical evidence to support their concerns. The fear and preoccupation often persist despite medical reassurances. Now, we will proceed to the key features of illness anxiety disorder, and here are the diagnostic criteria of it. It includes preoccupation with having a serious illness. It is the individual is preoccupied with having a serious medical condition and is excessively worried about their health. They may persistently believe they have a specific illness or fear developing a serious disease, even when medical evaluations and reassurance from healthcare professionals indicate otherwise. Now we have somatic symptoms not present or mild. The individual somatic symptoms, if present, they are either non-existent or only mild in intensity. If there are any symptoms, they are typically not medically explained or are unrelated to the individual's excessive health concerns. For the third one, we have excessive health-related anxiety. The preoccupation with illness causes significant distress and anxiety, leading to impaired functioning in daily life. The person may experience excessive anxiety about their health status, constantly seek medical reassurance, or excessively monitor their body for signs of illness. The fourth one is excessive health related behaviors. The individual engages in excessive health related behaviors such as frequently researching medical information, seeking repeated medical evaluations or tests, or avoiding situations that they perceive as increasing the risk of illness. Example, avoiding contact with sick individuals or public places. Now, for the fifth one, it is the duration of symptoms. The excessive worry and preoccupation with illness persists for at least 6 months, although the specific illness period may change over time. The last one will be not better explained by another mental disorder. The excessive health concerns are not better accounted for by another mental disorder, such as panic disorder, obsessive compulsive disorder, or generalized anxiety disorder. In the DSM-5, there is a specifier that can be applied to illness anxiety disorder to indicate whether the individual has care-seeking or care-avoidant behaviors. The specifiers for illness anxiety disorder are as follows. For the care-seeking type, this specifier is used when the individual with illness anxiety disorder engages in frequent medical consultations, undergoes extensive diagnostic tests, and actively seeks reassurance and medical care. They visit multiple healthcare professionals in search of a definitive diagnosis or reassurance about their health concerns. Care avoidant type is the second type, which this specifier is used when the individual with illness anxiety disorder actively avoids seeking medical care despite their persistent health concerns. They may avoid doctor appointments, refuse recommended medical tests, or dismiss the need for medical intervention. This avoidance behavior can stem from various reasons, such as a fear of receiving a confirmed diagnosis or a belief that medical intervention will not be helpful. These specifiers help to describe the predominant behavior exhibited by the individual and provide additional information about their illness anxiety disorder presentation. These specifiers are not mutually exclusive, and an individual may exhibit aspects of both care seeking and care avoidant behaviors at different times or in different contexts. It's important to note that the diagnosis of illness anxiety disorder requires a thorough evaluation by a qualified healthcare professional, such as a psychiatrist or psychologist. They will consider the presence and severity of the symptoms, rule out any underlying medical conditions, and assess the impact of illness anxiety on the individual's functioning and well being. Individuals with illness anxiety disorder are not intentionally feigning their symptoms. They genuinely experience intense anxiety and distress about their health, often believing that their symptoms are evidence of a serious illness. The cause of illness anxiety disorder is unknown. But factors such as genetics, personality traits, and life experiences may contribute to its development. The condition may also coexist with other mental health disorders such as anxiety disorder or depression. The development of illness anxiety disorder is likely multifactorial and an individual experiences may vary. The interplay of cognitive, emotional, learned behaviors, and environmental factors likely contributes to the development and maintenance of the disorder. The treatment for illness anxiety disorder typically involves a combination of psychotherapy, medication, and education about the nature of the disorder. Cognitive behavioral therapy or CBT is often effective as it helps individuals identify and challenge their irrational beliefs about their health. Medications such as selective serotonin reuptake inhibitors, or also known as SSRIs, may be prescribed to help manage anxiety and related symptoms. If you or someone you know is experiencing excessive worry and fear about having a serious medical condition, it's important to seek professional help from a mental health provider or healthcare professional experienced in treating illness anxiety disorder. They can provide the proper evaluation, offer appropriate guidance, and develop an individualized treatment plan. That's all for illness anxiety disorder. Hope you guys enjoyed listening and learning with me. If you feel you need support, seek help from professionals. Thank you and have a nice day. Bye.